Hi, my name is Joshua Bauml from the University of Pennsylvania, and I'm pleased to tell you the preliminary results from the Keynote-055 study, which evaluated pembrolizumab after platinum and cetuximab failure in head and neck cancer. These are my disclosures. So there really are no effective treatments for recurrent or metastatic head and neck cancer that's refractory to both platinum and cetuximab. And there's a reason to believe pembrolizumab, an anti-PD-1 antibody, might be effective here because both PD-L1 and PD-L2 are upregulated in head and neck cancer. Pembrolizumab was well tolerated and had durable anti-tumor effect in the phase 1b Keynote-12 study. This was the schema for our trial. All patients had recurrent or metastatic head and neck cancer that was refractory to both platinum and cetuximab. This was PD-L1 agnostic. They could be PD-L1 positive or negative, but we did check every tumor for it. They were given pembrolizumab 200 milligrams every 3 weeks at a flat dose, and this was continued for 2 years or until progression of disease or intolerable toxicity. Here's our screening group. We screened 228, enrolled 172. 171 patients received at least one dose. I have for presentation here today the safety data for all dosed patients, as well as the efficacy data for the first 50 dosed patients and for those patients who have received at least 6 months of follow-up. That's an additional 42 patients for a total of 92. These are the baseline characteristics. It's a classic population for head and neck cancers, age around 60, predominantly male. This was heavily pretreated. Over 80% of patients had received at or more than 2 prior lines of systemic therapy. Treatment-related adverse events, in short, this was a very well-tolerated agent consistent with prior studies of pembrolizumab. 15% fatigue was the most common treatment-related adverse event, but there were only 12% grade 3 to 5 toxicities, though this did include 1 treatment-related death due to pneumonitis, which is a known rare side effect of this class of agents. Here we have the overall response rate for the first 50 patients at 18%, made up entirely of partial responses and 18% stable disease. And we can see with greater than 6 months follow-up, our results are confirmed in the 92 patients. The remainder of my analyses focus on those 92 patients. You can see here by HPV status, there was a slight numerical increase in the HPV status, in the response rate by HPV status, 22% versus 16%. But at this time, our numbers are small and the confidence intervals are broad. So it's a little premature to really make a determination based on this. This was breakdown by PD-L1 expression, and you can see that those patients who are PD-L1 positive did numerically seem to have a greater response than those PD-L1 negative, 17% versus 8%. And it's also important to note that the rate of PD-L1 positivity was pretty high at 76 out of 92 patients, which is higher than we see with many other tumors. Here's the waterfall plot. You can see that 54 patients had a decrease in their target lesions, which is impressive given the fact that many of these patients, as I said, were heavily pretreated and they have poor available options. Here's the swimmer's plot. You can see that 75% of patients who responded remain in response at this time, and the median time to response is 2 months, though there are responses that happen after that. Here's the progression-free survival curve. You can see the median is 2.1 months, but as with any immunotherapy trial, the real story is in the tail of the curve, and you can see at 6 months we still have 24% rate of progression-free survival. Here's the overall survival curve with a median again of 8 months. This compares very favorable to the historical reference population of patients treated with methotrexate, who on average have an overall survival of only about 6 months. In summary, this is the first report of phase 2 data showing efficacy of pembrolizumab in recurrent metastatic head and neck cancer. This was a heavily pretreated population. 84% had at least 2 prior lines of therapy, and a meaningful response rate of 17 to 18% compared to 5% with methotrexate. Encouraging overall survival at 8 months, and this was well tolerated even amongst patients like this who were heavily pretreated. I think it's very fair to say that pembrolizumab is a promising therapy for this patient population with very few available options, and there are ongoing phase 3 trials evaluating this further. I thank the patients and their families, and these are my collaborators at various institutions.